Welcome to this ACT workshop. I'm Leslie Farrington, one of the co-creators of the ACT curriculum. In this short video, I share our essential take-home messages, which give a foundation for applying the ACT advocacy tools and tips in healthcare settings. The Black Coalition for Safe Motherhood's mission is to improve Black maternal health through promotion of healthcare advocacy and holistic community support of birthing people. Our ACT workshops are grounded in the African guiding principle of Ubuntu, which means I am because you are. Ubuntu reminds us of our shared humanity and that we stand in solidarity to build a thriving, beloved community, and this workshop is a healing space. ACT stands for Ask Questions Until You Understand the Answers. Ask questions, in fact, until the answers make sense to you and that you're satisfied with the answers. Claim your space, physical and mental, means your bodily autonomy and your dignity and self-determination. Trust your body refers to paying attention to your symptoms. Don't dismiss the symptoms. Report them. Make sure your voice is heard. Tell your story could be telling your symptoms or your concerns to your provider, to your supporters, your doula, your loved ones, and making sure that your voice is heard. Tell your story could be letting the provider know if they said something that you felt was disrespectful. Tell your story could be sharing your story so that others can learn from it or to heal from a traumatic situation. To assert our rights, we must be aware of our rights. And these three are essential for everyone to be aware of. Everyone has the right to the human right to respectful, safe, quality care. Everyone has the right to ask questions and get the information they need to make informed decisions about their health, their pregnancy, and birth. And everyone has the legal right to informed consent before agreeing to or refusing any test, procedure, operation, or treatment. In addition, we sometimes have to remind ourselves and others that childbearing does not limit rights to bodily autonomy, dignity, and self-determination. The pregnant person is the decision maker for their baby, and this is included in the right of refusal of recommended treatment statement from the American College of OBGYN. Put it another way, and now I'm quoting, pregnancy does not lessen or limit the requirement to obtain informed consent or to honor a pregnant woman's refusal of recommended treatment. Again, this is from the American College of Obstetricians and Gynecologists Committee on Ethics statement that they came out with in 2016. The informed and involved patients get better outcomes, and it's a legal right to be informed fully by the medical provider. Whenever they're recommending any tests or treatment or procedures, providers must explain the nature of what they are recommending in language that the person can understand, and with an interpreter if English is a second language. They must describe the risks and benefits, the pros and cons of the intervention that they're recommending. And that includes the pros and cons, risk and benefits of alternative options, including doing nothing. This discussion must be based on the best medical evidence available, not provider preference. Sometimes a second opinion is helpful to be fully informed. Written materials or decision aids can help to be better informed and can help the communication. That way, a person can decide what is the best option for them, the option that is in line with their needs and desires. It's a conversation, not a form. And even if a form is signed, a person can change their mind and refuse the procedure. That is their right. Vetting services. Again, the informed consumer gets better results as early as possible in the pregnancy, and even prior to pregnancy, if possible. The birthing person will benefit from learning about pregnancy and birth. And the place of birth is a major influence on experiences and outcomes. So it's worth the effort to find out as much as possible when choosing a provider, a hospital, or birth center, or deciding to give birth at home. Doulas, family, and other supporters can supply information, but do not decide what the client should choose based on their views and opinions. Instead, they can help vet the services available in the area, check out the C-section rates, the IRF app reviews, provide evidence-based information, provide educational resources, including childbirth education. It's up to the mom to decide what's best for them. Now, in some parts of the country, the options are limited, and birth workers in such areas may want to advocate at those places of birth for implementation of new policies as outlined in the new White House Maternal Health Blueprint. And they can be encouraged to achieve the birthing friendly designation. An advocate at all medical visits and during labor and the birth improves the safety and security of the birthing person. An advocate is a trusted friend or family member, trusted to keep the mom's confidentiality, reliable to show up. And this could be the doula or community health worker who is at the visit or on the phone. They'll show up when needed, and they are able to communicate with the healthcare team. You don't want to have a family member who's got a chip on their shoulder and has difficulty communicating. The advocate helps mom voice questions and raise concerns when they might be otherwise intimidated or in pain. So in those cases, they might say what they know that the birthing person wants them to say. But the advocate does not impose their opinions or preferences. They do keep notes, make lists of questions, and do research for moms on their issues of concern. The advocate can also support the mom by making sure that their needs are met. For example, if the room is cold, asking for a warm blanket, and making sure that safety protocols are followed, such as hand washing before touching the person in bed, and checking medications to prevent medication errors. Hand washing can reduce the risk of infections, and checking medications can prevent dangerous errors in getting the wrong medication. See our glossary for more on the role of an advocate, especially in terms of patient safety. We have articles there in our glossary. Finally, support is healing before, during, and after birth. Community health workers and doulas help to reduce stress along with the support of friends and family. Making sure all needs are met can significantly improve outcomes for both mom and baby. So we're saying encourage moms, shield them from discrimination, make sure they're comfortable and comforted, that they have access to really good nutrition. All of this can, again, significantly improve outcomes for both mom and baby. So we're encouraging everyone who does become pregnant to gather a support team, and for those in the community, including doulas and community health workers, to be part of a mom support team. The stress of racism, disrespectful, dismissive healthcare, and the fear of complications can be relieved with compassionate and supportive care. It can heal the effects of those stresses. A significant proportion of deaths and complications occur after a mom gives birth, So it's important to be aware of the early warning signs of those complications if they develop. And then, because moms are focused on their baby after they give birth, helping mom to get prompt medical attention after the birth is an important job for the support team. In summary, everyone has the right to dignity and autonomy. If the birthing person is fully informed, they are better able to take charge of their health. Birth workers and supporters can help vet the services to get the best in the area. Support improves perinatal experiences and outcomes. And it's important to have an advocate to get the best personalized attention.